Okay, here we are live with Molly from our office here, excellent physical therapist, Molly. We're going to go through the hyperboloid, just a few basic exercises. So now we're going to have Molly demonstrate with the hyperboloid between her central incisors. The hyperboloid, which you'll see in a separate picture, is it's shaped like a hyperboloid, and it's designed to be shaped similar to the disc that sits on top of each of our condyles in our temporomandibular joint. The dental floss attached is merely a way to, obviously, thank God no one has ever swallowed one of these little guys, but should you or get close to that, you have a means to pull it out. But also in other instances, we will use the string as a means to apply resistance, pulling or tugging on the hyperboloid, so you're forced to use your muscles in a different way, or possibly work on good lip seal if you have weak lip musculature, etc. So a couple of the things we're going to highlight. Number one will be Molly working on lateral excursion to the right, or moving her mandible to the right. So Molly, let's do maybe 5 to 10 reps just to demonstrate. I encourage people to look in the mirror because a lot of times they'll move their lips but not their mandible. And then I might encourage them to take the index finger of her right hand, touch the lower part of her chin just as a manual cue so they know to go to the right. Or in later phases, we can do 1, 2, 3 finger pressure to either do an isometric or static contraction of various muscles of mastication, or more of a manual resistive exercise with movement. So now we're going to have Molly work on lateral excursion to the left. So same principle, but just beware. You might see asymmetry in movement, challenges in movement. If someone has medially and anteriorly displaced disc on the right side, they might have a challenge going to the left till you work through some of the other manual techniques. But generally, lateral excursive movements are relatively painless, and by improving lateral excursive movements, we can help improve ultimately mandibular opening. So again, Molly would do the same thing, move her mandible to the left 2 or 3 times just to get a feel. Look in the mirror so she can make sure she's moving her mandible, good postural alignment at all times, and or 1, 2, or 3 finger palpation on the left side of her lower chin or mandible just for manual cueing. And then the next exercise I would have patients do, although typically later in the rehab, is protrusion, or moving the mandible forward. Again, engages slightly different muscles of mastication, but very important muscles. Protrusive movements tend to be painful for those acute early disc problems or joint problems. So that's why, as I stated, I tend to introduce protrusion later in the process of the rehab. But again, you could do the same principle, look in a mirror, move the mandible forward, notice if there's any deviation or deflection of the mandible that could be corrected, and then ultimately 1, 2, or 3 finger resistance when appropriate. And then one of the final exercises that usually gets people laughing a little bit, certainly salivating, is to take the hyperboloid and literally move it from one molar, so her back left molars in this case, all the way to the right back molars. And this is forcing her to use her lips, her tongue, all of the muscles of mastication to make sure they're working in good unison, really in every versatile movement the jaw makes, whether we're speaking, chewing, singing, etc. And again, if you remember, it's also a great way, again, because of the increased salivation that occurs, producing some enzymes that can help with halitosis or bad breath as well. So again, great exercise to really try to engage all the movements that the temporomandibular joints can do in the appropriate muscles.